that minoxidil is working is when your hair starts falling out even more.
Board certified dermatologist here. I specialize in hair loss within my practice, and I'm going to tell you some things you need to know about minoxidil that not everyone tells you before you start. These are kind of key for getting the best results and having the most successful minoxidil journey overall. If you're going to start minoxidil, you need to fully understand that you may experience worsening hair loss for the first couple months of treatment. This is called the dread shed, and it's essentially the minoxidil kicking out your old sleepy hair so new fresh hair can grow. If you're not aware that this could happen, it can be horrifying. What I always tell my patients is it's a good sign. If you have increased shedding when you start minoxidil, it means you're responding to the treatment. Just hang in there, give it a few more months. Secondly, if you're female, do not bother with women's Rogaine. It is a less effective concentration and it is often more expensive. There is absolutely no reason, safety or otherwise, that you cannot use the 5% men's Rogaine. Third thing is minoxidil comes in both a liquid solution and a foam. One is not more effective than the other, but the foam is significantly less irritating to your scalp, so it's what I recommend. Also, generic minoxidil is the same as brand name Rogaine, so you don't need to spend for the label. Every patient who leaves my office, if we've discussed topical minoxidil, knows that it is toxic to cats and dogs. This doesn't mean you can't use it if you have a pet, but you have to be very careful about not leaving your product out on your counter or your pet could get it, and not letting your pet lick your fingers or your scalp or anywhere you've applied it. Small cats and dogs are at even higher risk, so you have to be really careful with them even sleeping on your pillowcase after you've used minoxidil overnight. If you have more minoxidil questions, let me know in the comments.